Kogut, and I've been at the University of Rhode Island for a long time, really, for about 20 years. And I've done work in mainly pharmacoeconomics and health outcomes research, mostly with state agencies, a lot of drug companies, payers, Blue Cross, and I've done a lot of work for CMS. Really pivoting at this point in my career to look for, seek funding from federal agencies and larger program grants, and thinking about this project as a platform to future work to to look at medication use among people with opioid use disorder. And this interest has been generated from a lot of time I've spent working as a pharmacist at Butler Hospital over the last 15 years or so. I've worked weekends and summers and learned a lot about medication use for individuals with opioid use disorder and other comorbidities. And I've seen a lot of medication use in combination with other medications that are that give the potential to increase risk of harm. So my project involves using the state's prescription drug monitoring programs data. We've used those data for projects in the past to look at the cost of opioid use in Rhode Island. We presented that research to the task force a couple of years ago. And we've done some other work looking at buprenorphine use in combination with tramadol, and published that last year using our Optum database. This COBRE project will be looking at buprenorphine use, and this isn't buprenorphine use for pain, this is solely for opioid use disorder, and to look at patterns of adherence and look at patterns of use of other medications that, as you might see here in the title below, presents additional risk. So we're talking about benzodiazepines, maybe Z drugs, and drugs like stimulants, any other controlled substance in addition with buprenorphine use. We're interested in using we will use the state's prescription drug monitoring program data to characterize and describe, and then maybe see if there's some impacts on or an association with medication adherence, both among prevalent users and people that are newly initiated to treatment. And we see this as a prelude to looking at medication adherence studies where we might be able to, or we would be able to incorporate some outcome data such as hospitalizations, potentially even overdose, and using other data sources, perhaps the APCD we've been thinking about. We also licensed the Optum database at Rhode Island at URI, and maybe to look at outcomes subsequently. So that's sort of my project in a nutshell. A couple of other things in the slide here. Up at top, you see advanced CTR. I serve as the director for tracking and evaluation for advanced CTR. So I have some familiarity with NIGMS and the ropes of these programs. My role with that program is really operational. We're tasked with keeping track of publications and grants and implementing an evaluation plan to help leadership understand how things are going. And you see a little bit about the things that I talked about in this cloud. I guess I hit all of those points.